So what I'm looking at is just to make sure that I'm not seeing anything unusual here on the day of the procedure.
Okay.
Both eyes look normal. All right, you can sit back. So that's good. No surprises there. Your job during the procedure is going to be to stare at the flashing green light.
Okay.
And that just helps maintain centration. So if you stay centered, it's faster. We can move along quicker.
Okay.
So if you move off center, it's not dangerous, but it does slow us down.
All right.
So I'm going to keep reminding you, look at the green light, find the green light, just to kind of keep you in that central zone. It's normal for the eye to move around. It's normal for the eye to try to hide. It likes to hide under the upper lid.
Okay.
That's part of the squeeze reflex.
Okay.
So if I see you squeezing and I see the eye jumping up under the upper lid, I'm just going to keep reminding you to look at the green light.
Okay.
And that'll bring your eye back down to that central zone where we can keep making progress.
All right.
The laser has an active tracking system, so it's going to be using an infrared tracking system to monitor the position of your eye. So the laser will not treat unless it's locked onto the pupil. If you were to sneeze or cough or make some sudden movement, the laser will just stop.
Okay.
So as soon as it detects that you've moved off center, it'll shut off. We recenter you, and it just picks up where it left off. So it doesn't matter how many times we start and stop. It'll just keep motoring along from wherever it left off.
Okay.
To do your treatment is really fast. The laser can do it probably in 10, 15 seconds. Obviously you'll be in there longer. You'll probably be in the laser room maybe 15 minutes, but the actual lasering portion of it is really fast.
Okay.
Yeah, a lot of questions we get are about blinking. Your eye's going to be held open, right? So we have a lid holder that holds the eyelid.
Okay.
So if you feel yourself blinking, that's okay. The eye that I'm working on is not actually going to close.
Okay.
So the lid will twitch, the muscle will move, but the lid won't actually close.
Okay.
There's not going to be a point in the procedure where I ask you not to blink. That would be impossible. Yeah. Yeah. So a lot of people are worried about that. They think there's going to be a critical moment where we say, okay, don't blink, and you're going to have to try to voluntarily not blink. And I'll be talking to you as we go through it. There's one step where we apply pressure. So that's the only point during the procedure where you can't see the flashing green light, is where we've elevated the pressure of the eye to create the LASIK flap, and that takes about 10 seconds.
Okay.
So about 10 seconds, you'll feel pressure and you won't see anything.
Okay.
And again, I'll be talking to you, so you're not surprised by that.
Okay.
Do you have any questions? All right. We'll take good care of you. When we're done with the laser and everything looks good, we're going to put a shield over each eye. We'll bring you back into one of the exam rooms just to rest. So we like to keep people for about 10 minutes after the procedure, then get one final look at you. Then once we've confirmed it looks good, then we'll let you go home.